Something that's been unique in my pregnancy is I have had no edema or lower back pain. Right now I am in my 3rd trimester and honestly, I feel pretty good overall. There's only been a few aches and pains with some joints here and there, my ribs, my lower abdomen. But in this video specifically, I want to talk about the things that I've done to be proactive to prevent getting edema and lower back pain, which are 2 of the most common symptoms women experience during pregnancy. If you haven't followed my pregnancy series yet here on YouTube, go ahead and check it out. I've been talking a lot about how to maintain a healthy lifestyle during pregnancy. For some reason, it seems to be a misnomer out there. I think the biggest issue we run into is within this space of health and wellness, there's a lot of misconceptions on what is approved or not approved during your pregnancy. And at the end of the day, you need to be the advocate for yourself and for your body, no matter if you're pregnant or not. Focus in on that, become super aware of our body, which I'm extremely passionate about, and making sure you are taking your due diligence to learn your body, communicate your symptoms and what you notice in your body to your primary care practitioner, midwife, doctor. So first and foremost, what is edema? Edema is basically the swelling in the joints, and it is the fluid buildup that happens because of a blockage in our lymphatic system. Typically, we're going to notice this in our feet, ankles, calves, and legs. And a lot of times, women are going to experience this as they start to put on weight during a pregnancy. Now, caveat here, most women are gaining weight during pregnancy. That's just fact. If you look at this chart, most women on average are gaining 15 to 30 pounds during a pregnancy. And a lot of this weight is going to be gone once you have that baby, because it is literally the weight of the baby, the fluids, the extra blood that you have in your body. This edema may be from your body not knowing how to move this extra weight. And if you are sedentary or you haven't taken time to focus on a healthy lifestyle pre-pregnancy, it's going to be a lot harder to manage as you are pregnant and going through the different trimesters, getting closer to your due date. So we talked about circulation and blood flow. Some things that I did to help improve this specifically is I dry brush my legs every single morning. And I actually do this even when I'm not pregnant. I was doing a lot during prep to help with circulation. And I do think that did help a lot with my lymphatic improvement. You can also get lymphatic drainage massages, which I hear a lot of people do get pre and during pregnancy as well. Something else you can incorporate is wearing compression leggings, compression socks, and watching for varicose veins. And unfortunately, I did get a varicose vein in my groin. So I started wearing compression socks every now and then and using some different natural herbs to help with blood flow. So that's something else you can incorporate as well. Another element to edema is going to be your blood pressure. Now, a lot of people do not track blood pressure regularly. I am an anomaly. I track a lot of my metrics on my own. I have actually had an improvement of my blood pressure from before getting pregnant to being pregnant. My blood pressure normally runs low. Now, if your blood pressure is increasing, which is very common because the total blood volume has increased in your body, we would expect this to increase as well. But once again, there is a tie to your lymphatic system and the circulation systems, whether or not you are going to have some challenges with edema and blood pressure. They're not always going to be a correlation between the two. But that's something I've noticed for myself is I've had really good blood pressure this entire time, keeping stress at a minimum. Some other things to watch for blood pressure is obviously your cholesterol, making sure you're eating healthy cholesterol foods. Eggs are going to be one of those most common. And even though people demonize eggs, they actually give you a healthy cholesterol. Oatmeal, another great one. So I know there's times you're gonna have food adversities. I've faced that too. If you can create a balance in your nutrition throughout your entire pregnancy, you should be able to work on improving your blood pressure as well. So when it comes to back pain, I honestly put a lot of this to my stretching and yoga practice. I've had a lot of weight training experience as well. So my muscles in my legs, as well as my back, are very strong. I also have very strong abs. Upon getting pregnant, I still try to maintain some weight training sessions and continue strengthening those areas while it was easier for me before my belly got larger. And even now, I am very mindful to incorporate different movements that are going to help with my erectors, my posture up, rolling my shoulders back. I hold a lot of stress in my traps. So maintaining a good posture is going to help prevent some lower back pain, but also having a strong core pre-pregnancy, I think, was a big part of it too. There's also correlation between my glute strength and my muscle bodies being strong to help stabilize me as well. Strength training definitely has been a benefit for me preventing back pain, as well as, like I said, yoga, incorporating different stretches for the body. And especially for some of you ladies who love weight training, if you're an athlete and you know that your lower back gets tight from too many leg days, you might need to taper it down. And that's just a matter of fact. This is a different phase in your life, a different phase in your health journey. Things are gonna be different. And I was really critical on myself in the very beginning of my pregnancy. I needed to get to the gym a certain number of days a week. If I didn't hit a certain level of volume, I was gonna be losing gains. But that's honestly not true as long as I maintain that, like we said, healthy balance for your nutrition, eating enough protein, and continuing to do the work that ultimately is what's gonna benefit me in the long term. Something else that's been very helpful is getting regular routine massages to help loosen up those tight muscle tissue, as well as if you do go to a chiropractor, making sure your alignment is good, which can be really difficult. I know as you get uncomfortable with the added weight, the belly, your sleep posture is going to change. That can add to some lower back pain too. I hope you found these tips helpful. Once again, I find myself in a really good position that I haven't had these challenges during my pregnancy.